I think at Barts Health, we think it's important to provide the HSJ for a number of reasons. And we spoke to senior people, and most people were accessing the journal internetly themselves. So we felt, based on feedback, to go for a group subscription made more sense. And as of today, we've got nearly 500 individual senior clinicians and managers signed up to access the journal.
So it's important to provide HSJ to provide trust because multiple reasons. For a start, I think I need to say it's something we've done for over a decade. So it's been the practice done before I became chief exec. The leadership really valiant going through the HSJ, with points in a direction of where things are going really well, organizations that are doing great things, innovative things, people can go to learn to share our experiences.
So I think there's a couple of big benefits for us of the access to HSJ. The first is keeping people up to date, helping them understand the bigger picture. The second, I think, is some of the analysis and reflections on policy and practice and how to respond to some of the big changes we're all facing. And all of that, I think, helps feed into when we're thinking through what the strategy should be for a service or the organisation. Knowing the context in which we're working, knowing what's going on elsewhere is really helpful.
It's interesting, actually, because talking to people about the HSJ solutions and insights piece, it seems to have been quite useful, particularly in terms of how an acute trust works with colleagues in an integrated care system, but also in local place-based relationships. And we've seen actual evidence where some of the insights of learning have been used to help inform our strategies locally, particularly in a place level around our hospitals. So
one of our trust values is we're always learning. I think using HSJ solutions is a real key part of that. I think of HSJ solutions as that library of best practice, and really encourage our teams to have a look. It spurs our teams on. We've seen our own trusts submit entries to national awards on the back of some of the things that we've picked up and changed practice on the back of HSJ solutions.
I think the HSJ Awards would help any project. It's a huge name in healthcare, and I think if you've won an award with the HSJ name attached to it, it will make anybody sit up and take note.
The key themes of my session were about turning analytics into action. And that's really important because that's why we're all here, to make sure that the data that we collect is used.
You will definitely hear something that someone is doing in a different way that you can take away and think, is that something I could explore for my own organisation?
The number one thing we do is build relationships. When you have to have the difficult conversations, if you've built the relationship of trust, then you can start making things happen together.
I frequently visit the HSJ website, possibly more frequently than I should. But the reasons why I do that are, number one, I think it's important to understand what other people are doing and to learn from that. And there's been a number of examples in the last couple of weeks. I thought, oh, that's really interesting. We make contact with them. How do we import that idea into my organisation? Secondly, I find it quite cathartic to recognise that other people are struggling with the pressures that we're facing, balancing finances, quality, access, workforce. So understanding that other people, whether that's in the articles or the comments, are in the same boat is really useful. We use it to advertise all of our senior jobs. We don't engage with management recruitment firms. We always advertise for free on NHS jobs and then through the HSJ. And invariably, we've been able to recruit people through HSJ jobs.